I was a patient in a maternal fetal intensive care unit in 1982, and it was a very new, unique medical service where high-risk moms that had gone into preterm labor could be on a research protocol that enabled the preterm labor to be halted. Now, if we weren't a research hospital with a teaching program, that clinical protocol to go on a particular drug that would stop preterm labor would not have been in place. So I went into early labor, and I was placed on this research protocol and put in a queue for one of two drugs that were being used. I was in the high-risk maternal fetal unit on the drugs, and they did stop my labor, and I was in there for many weeks. Now, when my daughter was born at 35 weeks, which was miraculous that I lasted to 35 weeks, she was a high-risk infant. Right there in the delivery room were the neonatal intensive care physicians who were just upstairs in the medical center. Now, if these two medical centers hadn't merged, those neonatologists would not have been there. When my daughter was born, just immediately after delivery, she had a team of neonatologists around her to take care of her. And she had some dustiness and apnea. She didn't need the full service neonatal intensive care unit. She needed what we called our intermediate care nursery, which was just one step down from the neonatal intensive care unit. And she stayed there for about 2 weeks with symptoms of preterm labor, which she overcame. But having that neonatal service right there made all the difference. It made all the difference to me as a high-risk mom to have the teaching program there, and it made all the difference to have the neonatologist there for my baby. It also made all the difference for me personally in my career, because I understood for the first time what it meant as a parent to have your child, someone that you loved, in the hands of other people. And so you experienced, and I experienced for the first time, what it truly meant. What did it mean? Why do we have Kapiolani Medical Center for Women and Children? Because when I went into early labor, they were there. When my daughter needed them, they were there. So for the whole rest of my career, I understood personally what my challenge was as an administrator, and why I knew that someday I was going to have the privilege to be a chief executive at that medical center, because it was something that I felt was destiny, in the sense that I knew I could provide for that medical center the resources that it needed so other moms and other parents could have the gift that I'd been given.